We have regular meetings twice a month, but we also have a lot of drop-in meetings. So our regular meetings are on the first and third Sunday of the month. Excuse me. And then I do drop-in meetings on the weekend. During the week, usually on Wednesday or Thursday. So we are doing a live support group meeting. Hello, Karina. It's nice to see you. If you can please let your friends know on Facebook or through your social networking, if you can link to this page, that would be so incredible. Let's see how patients are doing during the holiday season, because the holidays definitely bring out the best and the worst in us, right? Yeah, they can. Holidays can be very, very stressful. And I want you to have a wonderful holiday season. I'd like you to be able to have a holiday where you're not worrying about your diet, you're not worrying about stress, you're not worrying about family, but that you can actually enjoy the day rather than think about and worry about your bladder pain, right? Hi, Bethany. What's awful, hun? The holidays and icy? Are you just feeling bad right now, or what? Hello, Corrine from Belgium. It's nice to see you again, hun. What time is it in Belgium anyway? It's about midnight? It must be midnight for you. Hi, Hendria on YouTube. We're simulcasting on Facebook and YouTube. Internet's being weird. I'm in the middle of a huge storm here in California, so if I disappear suddenly, you know why. Hendria you actually, you gave me a great opening for what I want to talk about. Hendria says, I'm always eating something that triggers my bladder. Some days I don't want to eat or drink. Hendria, we need to know, number one, which subtype are you? Do you have Hunner's lesions, or do you have bladder wall driven symptoms? Right? Those are the ones that are going to be the most reactive to food, especially, they're just the most reactive to food. And this kind of brings up what I wanted to talk about today, which is kind of food and processed food. I was reading an amazing article today. I'll post a link to it on our Facebook page and on our website. A brilliant article on chronic disease and the food industry, and how our food industry today, we have been trained to eat processed food. And when you eat processed food, we know you're eating a lot of sugar, and a lot of people are thinking that, sugar is fairly meaningless, except if you eat a lot of it, which drives up insulin, of course. But there are other kind of dastardly things that sugars do in our body, and I'm not an expert at it. I need to read more about it. But anyway, aside from the fact that sugar triggers addiction. So why is there so much sugar in all of our food, and why is there artificial sugar in all of our food? Because it trains your brain, and it triggers an addiction center to your brain. And, the article made a really interesting comparison because normally in the environment, sugar is accompanied by fiber and vitamins and all sorts of really good stuff, right? The human body, and they talked about it. See, I've got to read the article again. I shouldn't. They talked about the role of sugar is almost to tell you that the food is safe. That's like the biological imperative of sweetness, is that the food is safe. When you think about ripe fruit, that means rather than unripe fruit is bitter. When you eat unripe fruit, like unripe apples, you're going to have a lot of gas and stuff like that. So kind of the thinking is that the biological imperative of sugar is that it has a way of telling you that this food is safe, and that the human body was never really designed to eat lots of sugar. And what we do know is that when you eat lots of sugar, you trigger an addiction response in your brain. And so the article really compared the concept of sugar in ripe fruit with the concept of highly refined sugar. And they made a comparison to cocaine. Because think about cocaine. Cocaine is processed from the flower, and then they refine it, and they do all sorts of things to get down to that raw molecule, that one super addictive molecule. And that's the same thing they do with sugar. Sugar is so highly refined. You're down to that one specific molecule of sugar. And in research studies, do you know that rats who are addicted to cocaine, who are introduced to sugar, will prefer the sugar? And they will walk across a hot mat to get to the sugar rather than the cocaine. That tells you how addictive sugar is and how dangerous sugar is. So when you think about processed foods, you're thinking about the holy grail of 3 really bad foods. You're thinking about high levels of sugar. You're thinking about high levels of processed starches. And again, you know, I don't know. Hi, Lisa from Texas. Um, um, so think about the history of white flour, right? So back in the 1600s and the 1700s, the only people who could do a white flour are the people who could afford to process the grain. And so these were the rich, the royals, the rich in England and in Europe. And if you go back in history and you look at the health of the people in Europe, they were constipated. They had massive problems, massive gut problems back then. Why? Because when you strip the grain and you remove all the fiber and all the vitamins, you're stuck with the equivalent of white flour, but you've lost all the good stuff. And so here you had the aristocracy struggling with all sorts of GI stuff. And it was the poor and the working class who couldn't afford to eat white flour, who were much healthier because they were eating brown flour. They were eating the good stuff. They were eating the wheat germ. They were eating the vitamins. And then someone invented cheap processing. So I think it was the late 1800s. And so then all of a sudden, everybody could afford white flour. And then everybody got sick. Everybody got sick. And if you go to around 1920, the big industry in the United States were colonics. Colonics. Why did people want colonics? Because they were massively constipated because they were eating white flour. They weren't eating any fiber. And then what happened is then they started tracking vitamin diseases. And I want to say beriberi, but I don't think that that's right. So they started tracking a high incidence of vitamin-related diseases. And it was kind of pretty undeniable. I think this was like 1910, 1920, somewhere in there. And then they came to realize that the white bread didn't have the vitamin that people needed to avoid these foods. So what did they do? Rather than admit the white bread was the problem, they just made fortified white bread. And that's why if you go into your supermarket today and you see enriched and fortified breads, white breads, that's them artificially putting the vitamins and stuff back into the grain that they've stripped out. I mean, it's insanity. Rather than admitting that the industry made a mistake by processing flours to take all the vitamins out and grains to take all the vitamins out, they just created a chemical to do it. And they created this, they perpetuated really what we're struggling today. And then, of course, we have to deal with the third of the holy grail of junk food, and that is fat. And you know, so I mean, there's kind of two schools of thought here. You remember about 20 years ago, people were saying that it was fat that was causing obesity. So all these foods came out that were low fat. And what they didn't tell you, if you didn't look at the ingredients, is, yeah, they might have been low fat, that they had triple sugar. So then we started seeing all these people becoming very obese. And you know it today in America, and anywhere you've got McDonald's, anywhere you've got fast food in the United States, in the world, you see massive obesity. And that's because we are not eating real food. And so if I have one dietary suggestion for you today during this holiday season, could you please eat real food? Step away from the fast food and the junk food. You know, there's a lot about modern life that just disgusts me. The people who put profit ahead of health is astonishing to me. Whether it's the people who are selling Coca-Cola or those highly sweetened drinks. And you've got families in low income places who cannot afford milk, and they're giving their babies soda instead. And so babies with teeth coming in have cavities. People in their 20s are losing all of their teeth because they haven't eaten a normal, healthy diet, right? So again, if there's one dietary suggestion that I can make for you this year is, would you please step away from all the fast food and junk food? Anything that comes in a box? Can you just get meat, and can you just get vegetables and maybe a whole grain bread and make a pie? But let's up our game here. The article said, I kept a couple of quotes here. We are the totality of our everyday choices: food, exercise, sleep, and stress. And it's not a short-term game. It's really, we're kind of in a society that says, you take a pill and you'll get better. It doesn't respect and understand the long-term consequences of the choices that we've made, as well as society influences. There are people out there who have never eaten real food. They are addicted to fast food. They're addicted to food. There were people who've never shopped in the vegetable line. They don't even know the difference between a zucchini and a pumpkin. I mean, literally, I'm not lying here. So we can't. We have long-term cumulative damage from our food, a lack of exercise, stress, and God knows life is really stressful right now. And you can't fix it in one easy pill. This is about making positive, productive change. Now, am I going to say that I think IC is part of that? Yeah, I do. I really do. I think that when I think back to my 20s, when I had irritable bowel and all these other stuff, and I occasionally struggle with irritable bowel, I really think that it's a product of our environment, and it's a product of what we're eating and what that does to our biome and our health and all that sort of stuff. Alrighty. So getting back to the question that Hendria asked on YouTube, because hello people, this is an IC support group meeting. I do my support group meetings. I have 3 sections to my support group meetings. Usually I do a little 10 to 15 minute educational thing, which I just did. And then I will take your questions, and then I usually have some giveaways too. So you just heard my little rant, but I want to get back now to Hendria's question, because Hendria asked the first question of the day. I'm always eating something that triggers my bladder. Some days I don't want to eat or drink. Hendria, here's the issue. There's a ton of food you can eat that won't irritate your bladder. And if you come over to our website, the IC Network, and look at our diet guide, it has 3 columns. It has it has bladder friendly, try it, and caution. I don't want you to eat anything on the caution. And right now, stay away from the try it column, and let's focus on the bladder friendly column for a while and focus on simple, fresh, healthy food. Like seriously, I think that you could have a vegetable soup that you make, no problem. I think you can go get a piece of meat and cook it. As long as you don't put a hot spice on it, it's fine. If you want to roast a chicken, you can do that. If you want to roast a steak, you can do that. If you want to have a pork chop, you can do that. I don't want you to put any hard spices on it. I don't want you to put MSG on it or any seasonings on it, anything at all like that. I want you to just get back to simple, fresh, healthy food. And when it comes to drinking, again, remember, our bodies were designed for life 5,000 years ago. What was the food 5,000 years ago? Water. That's what our body is meant to hydrate us, is water, and maybe the water that comes in fruit and stuff like that. So step away from anything that's canned. If you need to have something hot, do hot water with a little bit of honey in it, hot water, chamomile herbal tea, peppermint herbal tea. You can have some milk. You can have some hot milk. That's where I would want you to start. And then you can go ahead and introduce, once your bladder calms down, you can introduce something like this. This is a rooibos tea. In fact, I haven't even drunk any water today. So rooibos tea works. But no coffee, no green tea, no black tea, no soda, no orange juice, no cranberry juice, no limeade, no lemonade. Okay, none of those are normal. Hey, listen, do you remember when we grew up, our juice glasses were this big? When they gave us juice in the morning, it was like 4 inches tall and it was thin. And now when you look at the juice people are drinking, they're drinking big old glasses of juice. That's a massive level of acid that your body is not designed to tolerate over time, along with a massive level of sugar, right? So, Henry, I hope that helped with your question. How about, Lisa says, how about homemade yogurt? Is that safe? I don't see why it wouldn't be. Oh, she says she very rarely cheats on diet, but you had movie theater popcorn on Friday and I'm still flaring. You know what? I have started buying organic popcorn and I love it. I absolutely love it. And let me go get it. Hold on. You know, we're always looking for snacks, right? I mean, like I'm always looking for a snack that is not sugary. Anyway, this is Field Day organic popcorn. And what's cool is if you look at the ingredients, it's organic popcorn, organic palm oil, salt, and butter flare. I wish it didn't have the palm oil in it. The palm oil is responsible for the destruction of so many rainforests. So I'm going to look for one that doesn't have palm oil in it. But anyway, look for an organic popcorn. You can even bring it with you at the movie theater. All right, guys, if you have a question, please feel free to ask. All right, Bethany says she is having pelvic floor and bladder pain, severe pain today. Not sure which one is acting up. I've tried all my tricks and you're in a level 8 pain. All right, so Bethany, the way that we figure out is we ask you a very simple question. When is your pain the worst? Before you pee or after you're done peeing? If your pain is worse as your bladder fills with urine and you feel a little better after you pee, that tells me that you're having a bladder wall flare. If your pain is worse after you're done peeing, that tells me that you're having a pelvic floor flare. So if you can answer that question, when is your pain the worst? Before you pee or after you're done peeing? That would be awesome. Hello, Karen from Phoenix. Hello, Sherry. Hi. Hi. Hello, Aaron. Hi, Amber. Hi, Gerald. Karen says sugar flares her fibro, arthritis, Epstein-Barr, shingles. You got that right. Hey, guys, if you could please, on your Facebook page, could you just please share that we're doing this chat right now? That would be so awesome. And while you're at it, guys, make sure you like the IC Network page on Facebook and or if you're on YouTube, because we are simulcasting on both. Make sure you subscribe to our YouTube page. Hello, Gladys from Louisiana. Hello, Connie from Washington. Hi, Omega. Thank you. You say I'm your number one source for all things IC. Thank you. I tell you, I read about it every day. Erin says that her family runs a farm, and there are people who come to the farm who've actually never seen the real thing. All right, Marianne says, what medications work best for IC? All right, so Marianne, let's talk, my dear, because what that tells me is you're not quite understanding what IC is, because we're not going to put you all in the same barrel. So 20 years ago, the assumption was that interstitial cystitis was an incurable bladder disease. That's what I was told when I was diagnosed 25 years ago, that it was, quote unquote, an incurable bladder disease. But what we knew even back then is that there was tremendous diversity in the IC patient population. You've got some patients with bloody bladder walls, other patients with completely normal bladder walls. Both would be diagnosed with IC, yet clearly we're extremely different, right? I mean, there's no doubt about that. We've got some patients with terrible pain, others with no pain. They just have frequency urgency. Both diagnosed with IC, yet clearly we're very different. And when you look at the things that often trigger IC, that's where you really see the diversity, because you see some people who get IC after having a baby. Others get IC after falling. They fall on their tailbone. They injure their tailbone. Some people get IC if they've been drinking diet soda for a decade, or coffee, the terrible diets. Others get IC after chemotherapy, right? Clearly, they're extremely different. And then if you go back in time and you go back to 1993, 1994, even earlier, and you look at some of the early descriptions of IC in research studies, they often described muscles so tight they resembled tight guitar strings, right? So even back then, even though they thought that IC was a bladder disease, everybody also knew that we had these remarkably tight muscles. And then I think it was like in the late 1990, I don't remember the year exactly. I look at my bookcase because I keep a lot of historical files in my bookcase because I've been doing this since 1993. I went to a National Institutes of Health conference on IC in Minneapolis, and there was a physical therapist, Rhonda Cotarinos, who was for the first time allowed to address the crowd. This was a gathering of all the top IC researchers in the world. They used to meet once a year, once every 2 years, and the National Institutes of Health paid for it. So they gave Rhonda a opportunity to speak at the very end of the day, and literally half of the doctors walked out and wouldn't even listen to her. And her position was, hey, I'm a physical therapist. I've been working with IC patients, and I am making them better. Here's why. Here's why that might make a difference. And slowly and Rhonda practices out of the Chicago area, South Chicago area. She's still in practice today. Slowly, doctors started accepting the fact that, hey, maybe muscles are part of IC. And then the National Institutes of Health decided to do a research study to prove it. They did a multi-center research study around the country where they had IC patients go through what they called pelvic floor myofascial physical therapy. And that data was released in 2008. And that data was stunning, because what that showed is that pelvic floor physical therapy was as effective, if not more effective, than all the other IC treatments. And when that study came out in 2008, that is when we all went, uh-oh, maybe IC isn't a bladder disease in some of these patients. Maybe IC has muscle origins. And it was amazing because up to that point, no one really believed or understood that pelvic floor muscles can trigger bladder symptoms of frequency, urgency, pressure, pain. But they do. So in 2008, we had a complete shift in our paradigm. We went from the position that IC was a bladder disease to IC is more of a pelvic pain or bladder pain syndrome, right? And so now, for the last 5 years, and it really began in Europe maybe 10 years ago, we're trying to understand the diversity of the IC patient population. We're trying to understand the subtype, because if there's one thing we know is that a one treatment fits all approach does not work. So when you ask the question, what meds work best for IC? Here's what we know. If I say Elmeron works best for IC, it's not going to work best for a lot of you. It's not. It's absolutely not. So now we are trying to understand your unique variation of IC. In fact, I was writing this last night, and I was creating a lot of new materials on our website. You know, one of the things that happens in social networking on Facebook and everywhere in any support group is you read all these bad stories of patients and you go, oh my God, this is going to be me. And what I wrote is like, no, it's not, because we have subtypes. And that patient online who might be struggling with very, very severe pain, and here you're thinking that's going to be you, she may have a completely different subtype than you. So the question now is, what are the subtypes? And let me get out my handy dandy slides. And I will explain your subtypes. And then we're going to come back to your question. What is the best medicine? And I will tell you what the best medicines are based upon your subtype. All right. Here it is. All right. I've done this many times. But you know what, guys? Seriously, read it, learn it, embrace it, breathe it, because this is the future of IC. And we're working with 5 core subtypes, but there are probably many more. And I will try to talk a little bit about them more. But subtyping began in Europe. There are 16 different variations of IC, bladder pain syndrome, as established by the European Society for the Study of IC. In Canada, there are 6 variants of IC that are part of what we call the U-point subtyping system. In the United States, we don't have an agreed upon subtyping system. So I use the subtyping system that was invented by or proposed by Dr. Christopher Payne, who ran the Stanford IC research program for 25 years out here in California. And one of the things in his article that he wrote a couple years ago to introduce this is he made the comparison of IC with cancer. And he said, listen, when somebody's diagnosed with cancer, man, you're given a very specific diagnosis. You're told that you've got cancer of the left breast. It is estrogen dependent, type 1, 2, 3. And the specificity of that diagnosis will then tell you what treatment you should be doing. And he says that does not happen in IC. When somebody is diagnosed with IC, you have no freaking clue what to do next, right? There is no logical intuitive pathway when you are diagnosed with IC. And he said the way we can give you an intuitive pathway is if we subtype you or phenotype you. Same thing. So here are his subtypes. IC subtype 1, Hunner's lesions. Everyone in the world agrees this is a distinctly different patient group. And in Europe, only patients with Hunner's lesions are actually diagnosed with interstitial cystitis. People without Hunner's lesions are diagnosed with bladder pain syndrome. In the United States, we call it ICBPS, interstitial cystitis bladder pain syndrome. In Europe, it's hypersensitive. In Japan, it's hypersensitive bladder syndrome. Okay, but clearly, everybody agrees Hunner's lesions are different. Hunner's lesions, these are the patients who have bleeding wounds in their bladder. When we look at their wounds with a hydrodistension, they have a waterfall effect of blood. Man, they bleed profusely. If you have lots of blood in your urine, visible blood in your urine, or you have a hydrodistension and you are peeing clots, the odds are you've got Hunner's lesions. And Hunner's lesions were the great mystery of IC, and they're still to a certain degree the great mystery of IC. Why do lesions develop on the bladder wall? And we kind of have 2 fundamental theories here. Fundamental theory number 1 is that lesion is caused by a nerve that is dysfunctioning, a massive neuroinflammation. When a nerve is irritated, it releases something called substance P. Substance P is very tissue damaging. And so concept number 1 is that it is a nerve that is massively inflamed. Concept number 2, supported by multiple research studies in Europe, is that Hunner's lesions may actually be the result of a virus living on that nerve. We've now have 4 potential viruses that have been linked to issues. The polyoma BK, the Epstein-Barr have both been found in the urine of patients with Hunner's lesions, but not in the urine of patients without Hunner's lesions. Hey, JJ, it's nice to see you, dude. Very, very nice to see you. Okay. And also the herpes virus and the HPV virus have all been linked to some urinary tract issues. So what is the best treatment for Hunner's lesions? Well, it's sure as hell not Elmeron. The best treatment for Hunner's lesions is going to be a steroid injection into the center of the lesion, or it's going to be cauterizing the lesion, or we have a new treatment currently under study, which is the first treatment in history that has actually healed Hunner's lesions completely. It's called Liris, Liris, Liris. And so if you have Hunner's lesions and somebody's treating you with Elmeron, that is not the right way to treat lesions. Lesions require lesion-specific therapy. Cauterization, steroid injection, or Lyris. There you go. Best quote therapies for Hunter's lesions. All right. Whoops, hold on. Hold on one second. Okay. So that was IC subtype 1, Hunter's lesion. IC subtype 2, bladder wall driven. So these are the patients whose symptoms are coming from some sort of basic bladder wall dysfunction. So, you have to understand that the bladder, like any other part of the body, can be injured. But how is it injured? Well, it can be physically injured. If you go and play soccer with a full bladder and somebody hits you with a soccer ball right in your bladder, yeah, it's going to rupture. It has ruptured before. If you are on a long car ride and you don't stop and use a restroom and your bladder gets very, very full, your bladder has the potential of rupturing. Okay, so the bladder can be physically damaged, obviously, by bullets and stuff like that. And I'll give you a little tidbit here. The bladder only knows one language: frequency, urgency, pressure, pain. Everything feels like infection because those are the only symptoms that the bladder can tell you there's a problem. You could have a bullet wound or a stab wound in your bladder and it would feel like an infection. It's really interesting. All right. So how can the bladder be damaged? Physically and chemically, which is why we know that chemo-induced cystitis, chemotherapy is one of the most common causes of IC-like symptoms because the chemicals of chemotherapy damage the bladder wall profusely. If you've been drinking diet soda, strong acids, coffee, energy drinks for a long period of time, listen, your bladder was not designed to be able to handle that massive acid load. It really wasn't. The acid in today's environment, it has caustic effects. It can damage tissue, especially over time. If you poured acid on your hand every day, what do you think would happen? It would get redder and redder and redder, and you foolishly keep pouring acid on it. Eventually, you're going to get wounds and blistering. You keep pouring acid on it. Eventually, you get a hole, and eventually, you see the meat. You see the meat in there. That's what acid erosion does. And that's basically, when you're doing lots of sodas and stuff like that, you get that in a slow motion effect. Right? So chemical irritation can cause bladder irritation. And there are also some subtypes here, some subtypes. We know, for example, that aging plays a role for some people, that when you don't have estrogen, when you're menopausal, you don't have as much coating as you used to have. And let me just show this to you. Here's a 3-dimensional picture of your bladder. And so you've got at the top of your bladder, you've got a layer of mucus. Then you have a layer of 4 to 5 cells that we call umbrella cells, a urothelium. And then underneath that, we've got blood vessels and nerves. So here's your coating. And you can see that your coating up here, because remember, your bladder's like your mouth. It's a hollow organ covered with mucus. This coating is a barrier. It keeps stuff in your urine from getting down here, which is important. But if you don't have coating, if it's been eaten away, the normal irritants of urine have an open door. They walk right down into these tissues. And acid on these tissues is damaging. Caffeine on these tissues is damaging. And this makes you more vulnerable to infection. So unfortunately, this layer of mucus is estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus. But when you're older, you have much less estrogen. Therefore, you have much less mucus. So you might have been able to eat coffee and stuff like that in your 30s, 20s, and 30s and 40s. But all of a sudden, when you're in your 50s or your late 40s, guess what? You can't do it. It's not a disease. That just means that your bladder's ability to protect itself because of the loss of estrogen has changed. It has changed. So there you go on that. Other subtypes, I think that there's a chronic UTI subtype. I absolutely believe that there is a chronic infection subtype in here. Not only chronic bacterial infection, but chronic fungal infection. Why do I say that? Because that's what the National Institutes of Health found. And their MAP Research Network, which is the federally funded research team studying IC and chronic prostatitis, they are the ones who use next generation DNA testing who found as an example, that many patients having flares have yeast infections in their bladder. Who knew? Who knew that you could have a fungal infection in your bladder, just like you can have a viral infection in your bladder, just like you can have a bacterial infection in your bladder? So we know that some patients have chronic yeast. We also know that some patients have chronic bacteria. And so if you're one of those patients where you just keep getting infection after infection after infection, like every 2 weeks or 3 weeks, bam, another infection, what we have to do is assume that you probably have a chronic infection. And what we do for that, we have to identify that chronic infection because we have to find out if it's drug resistant or not. And you do that with next generation urine testing. Next generation urine testing. So if you go to bladderhealth.org, you will see a whole bunch of videos of urologists who use this now. And in fact, in our last meeting, it was interesting. We had 2 patients this Wednesday, one who did it, and they found an infection that they were able to clear up and her symptoms have improved. And another patient, they found a very, very, very drug-resistant E. coli infection that they have now thrown 3 antibiotics at, and they still have not been able to kill it. So there is a subtype of chronic infection in bladder wall driven. So what is the best medication in this one? Well, it kind of depends upon what your variant is, but with the odds are you're going to be using a bladder coating. You're going to be doing something that will cover the wounds, right? If you don't have a good coating in here, then what we want to do is put another coating in here that will at least protect your tissue. And so the coatings that are most commonly used are Elmeron, which is an oral medication that unfortunately has now been linked to eye disease, or you can do the supplements. You can do Cystoprotec or Cystorenew or Desert Harvest Aloe. These have a coating effect. So you can see why, again, if you have a damaged bladder wall, if we can at least put something over that wound so that urine can't get into that wound, that's what makes sense. And this is actually one of the old Elmeron educational slides. So this is how they show Elmeron working. Okay. Now, other medications you can use for bladder wall driven are going to be an antihistamine. Why? Because down here, you've got mast cells that when things get irritated, the mast cells trigger irritation. So the concept of an antihistamine makes complete sense, along with something that will calm irritated nerves, like a low-dose antidepressant, like low-dose Elavil. That also can help stabilize some of these potentially irritated nerves for IC subtype 2. And of course, if you are menopausal and you've got dry skin, then you're going to be using some estrogen, perhaps, a vaginal estrogen cream. If you've got chronic infection, we're going to focus on trying to identify the infection and trying to find the correct antibiotic for that infection. All righty. IC subtype 3. Hey, I bet you didn't think you'd get this big answer, did you, Mary? I can talk about this stuff forever. IC subtype 3, pelvic floor injury, pelvic floor driven. These are the patients whose symptoms began after some type of muscle trauma. And this is the largest subtype, I think. And I believe that it was Dr. Robert, no, I think Chris Payne said that in his article. But anyway, it is believed to be the largest subtype, and I happen to agree with it. So these are the patients whose symptoms began after a car accident, after a fall, after having a baby, after a rape, after sexual abuse, after something that has been traumatic to their muscles. So what happens is, I need to get a stuffed bladder for my demos. Okay, so look, here's your pelvic floor muscles, and the yellow ball is your bladder, right? So what's so cool about the pelvic floor is that it's the only muscle group that is incredibly involved in normal daily functions, which means it has holes in it that allow urine to come out and poop to come out and a penis to go in if you're a woman or whatever. You know what I mean, right? So normally your pelvic floor is very loose, it is very stable and comfortable and pliant, right? When your pelvic floor is injured, it gets weak. Anytime you sustain a muscle trauma, muscles are weakened. And then because those muscles have a job to do to hold your bladder in place, they start overcompensating by getting tight. So what happens is they start to squeeze down. And so here we've got a normal bladder that now is being compromised by very, very tight muscles. So what do tight muscles do? Tight muscles restrict blood flow. And when you restrict blood flow, guess what? It's really hard for the bladder to be healthy. So I figured this out in one of our other things. So look, if you squeeze your hand, right, really hard, your wrist, then you let go, look, you can see the blood is missing, right? And then it takes time for the blood flow to come back and make this thing. Okay, now I want you to think about your bladder being squeezed. Your bladder is being deprived of essential nutrients and oxygen. So eventually what happens is because your bladder cannot be maintained healthily, it starts to break down. Now, for the typical pelvic floor patient, you have no clue that you have a muscle injury. None at all, other than that you probably fell or you had a baby or whatever. Your first sign that there's a problem happens long after the injury, when your muscles are so tight, your bladder wall starts to break down and you get frequency urgency. So here you are, you're going, I must have infection. You call the doctor. Hey, doc, I think I have an infection. Can you give me some antibiotics? The doctor throws you antibiotics. They don't work. You call the doc back. Hey, you know what? It's not here. Can you send me some more? The doctor, if he's smart, says, no, I'm not going to send you more. I need you to come to the office so we can do a culture, he or she. So then they do a culture. The culture comes back negative. But the doctor might go, maybe you got an infection anyway, and they give you antibiotics for 3 months. None of it works. You come back to the doctor, and the doctor goes, well, maybe you've got overactive bladder. They throw you overactive bladder medications like Detrol or Ditropan. They don't work. You go back to the doctor goes, maybe you've got interstitial cystitis, and they throw the diet at you and Elmeron at you. And they don't work. And here you are in this chat meeting right now, and I know some of you are watching this right now who are exactly in this spot. None of your bladder treatments are working. Why? Because your problem isn't with your bladder. Your dominant problem is terrible blood circulation because you got muscles so tight that they're depriving the bladder. So the therapeutic priority for this patient is to restore blood flow. How do we do that? With physical therapy, right? We need to get things opened up again. And when the National Institutes of Health released that major physical therapy study in 2008, that's again what drove this. Now we know why muscle therapy works. It works, and it works beautifully. So what is the best therapy for this? I mean, what's the best treatment for this? What's the best medication for this subtype? A muscle relaxant, baclofen, Flexeril, vaginal Valium, but those aren't even as good as just working with the muscle. We need hands-on physical therapy, people. Man, because again, your muscles are super tight. So what's going to happen is they're going to stick a finger up here and they're going to slowly work it, and they're going to lengthen it, and and it works. I had that hysterectomy last year, 18 months ago, not last year, the year before that. I can't believe it. And I had, so they took everything, including my cervix, and I had this pulling sensation for 10 months. I mean, really uncomfortable. And it was muscle spasms. It was levator ani muscle spasms. The doctor said, yeah, I can see your muscles vibrating. You're having involuntary spasms. You need physical therapy. Took 3 visits to the physical therapy for the spasms to stop. And they did. And I'm so grateful. But it's pretty weird laying there with your knees open with somebody having their finger up touching things. But do it. You can't access these muscles any other way. It's okay to do it this way. There's no shame. There's no blame. This is about figuring out why your pelvis is hurting. And muscles are often the missed cause of that. Okay? And one last thing, Patients with muscle issues, when I ask the question, when is your pain the worst, before you pee or after you're done peeing? For them, it's after you're done peeing. They tend to not have issue as their bladder fills. They tend to have issues as they're peeing and afterwards. Also, the flare you have when you're sitting in a car, when you have sex, when you move, those aren't bladder wall flares. Those are pelvic floor flares. Those are muscle flares. Okay. IC subtype 4 is pudendal neuralgia. This is a nerve injury. So for these patients, their symptoms are positional. You're fine when you stand. You're fine. You sleep all night. You're fine until you sit on the side of the bed. Then you're in agony. Or if you bend over, you're in agony. You get a shooting nerve pain down your leg like sciatica. Or you might have persistent genital arousal disorder, where, you feel this icky, slightly aroused, this hurts, I don't like this at all sensation, which means that the pudendal nerve is being compromised by tight muscles. And so for these patients, what's the best treatment for this? What's the best therapy for this? Well, they're going to probably be doing something like gabapentin, things that calm nerves down. But again, we're going to go right back to muscle therapy and muscle relaxants to calm those muscles. And to get them to release the nerve. And then the last subtype is IC subtype 5, central sensitization. This is the inherited subtype. This is my subtype. When I was in my 20s, I had, in high school, I had vulvodynia, and then I started throwing ovarian cysts, and then I got food sensitivities. And, it's this craziness. It was like I could not figure what the hell was going wrong with my body. And then it was the University of Maryland, which released data which showed that there can be an inherited component to it. Well, and you know what? My sister, my mother, my grandmother, my aunt, my cousin all had these bladder symptoms. So it's like, oh my God, wait. You mean it wasn't my fault? I inherited this? Holy crap, this is good news. Or central sensitization can happen after a traumatized injury. So what is central sensitization? It means that we have a nervous system which is easier to turn on. It's all about the action potential of the nerve. You take a normal person, you put 500 cc's of fluid in their bladder, they can walk around for hours and not feel the need to pee. You put 500 cc's of water in my bladder, I want the bathroom. Now, you think I'm going to walk around with 500 cc's of urine in my bladder? Hell no, I'm going to need a bathroom quickly. And yet when you look at my bladder, it is completely normal. It's normal. And that's because I have sensitive skin. I am food sensitive. There are some foods that just disagree with my entire body, like chocolate and oatmeal. I'm drug sensitive. I can't take normal doses of medication. I have to take half doses or baby doses or pediatric doses. We have a wicked sense of smell. We can smell things that other people cannot smell. Some chemical sensitivity, chemical odors in our home really provoke pain. It's so weird that for some of us, a smell can provoke pain, but it does. Why? Because the action potential of our nerve is simply lower. Okay, so for us, what's the right treatment for us? Well, the right treatment for us is, number one, changing our environment so our nervous system is not being overstimulated. It would be absolutely foolish of me to drink caffeine when I have this, because what does caffeine do? It turns nerves on. I want to calm nerves down. People with central sensitization, we tend to live in the country. We don't do as well in the city with all the smells, sounds, all that sort of stuff. We tend to live a little bit of a quieter life. We do better in a quieter environment than a louder environment. Anyway, I talk about that a lot more on our website. Also, one other thing about central sensitization is because we have a lot of chemical sensitivity, we also have a lot of anxiety because our body is being overstimulated by adrenaline. And I have a video on our website on anxiety and IC, but I've talked about it here. For us, because, again, our nervous system is more easily triggered, it's very, very important that we keep stress levels low and we learn how to control adrenaline. And I can talk about that later if you want. And so from a therapeutic standpoint, what's the best medications for us? Well, again, if you're drinking caffeine and you got central sensitization, it's your own damn fault. If you are living in a very loud, caustic environment, if you're working in a factory with a lot of chemicals, there's no therapy that's going to fix that for you. It's about respecting the fact that our nerves are more sensitive and we have to protect them. And there might be some medications that they can use also that can help calm things down. But in the end, it's the gift of our ancestry. I think that, I mean, look at me. I'm a redhead from Norway. My family came from the Arctic Circle in Norway and Sweden. What were we eating 5,000 years ago? The world's blandest diet. We were eating fish, we were eating deer, we were eating apples, we were eating greens. There was no caffeine to be had. And I think that sensitivity was an evolutionary adaptation to help us find food. So I don't look at sensitivity as a bad thing. I think the world needs more sensitive people, because we are remarkably empathic and intuitive. So there you go, Marianne. How is that for a 20-minute answer to your question? What medications work the best for IC? Let's go to some more questions. Charlene says, is prolapse common with IC? And the answer is no. Prolapse is common with pelvic floor dysfunction. So again, here's your normal pelvic floor. If your muscles have been weakened, what happens? Ooh, your bladder starts to fall. Where does it fall? At your vagina. So if they catch it in time, if they catch it when it's just starting to fall, they can do physical therapy and give you exercises to strengthen those muscles to get them back together. And generally, when you have pelvic floor physical therapy, remember you got muscles super, super tight. The first thing they're going to do is try to relax the muscle, but then they're going to try to strengthen the muscle. You don't just relax, you have to relax and then strengthen. So if you have a double prolapse, then that tells me that your pelvic floor has been really damaged. And the question is what to do. The odds are, if it's as severe as you say it is, you're looking at some sort of suspension surgery to get it back in place. Because I'll tell you, walking like this with a vagina, with a bladder hanging out of your vagina is not easy, and it's a very, very painful. So what they may do is give you a pessary to put up your vagina to kind of put things in place, and then they might eventually do a surgery to help that. Hendria on YouTube says she was drinking real fruit juice, thinking it was better than sodas. Then you had back-to-back UTIs. Then I was diagnosed with IC. So, Hendria, if you look at the ingredients for the fruit juices, I can guarantee you most of them had citric acid in them. Also as a stabilizer. So not only did you have the massive acid of the juice, but you also had the massive acid of the preservative. And so the odds are you just irritated your bladder wall. And especially if it were cranberry juice we call the acid bomb. It is brutal in an IC bladder. All right, let's keep going here. Let's see, Karen says, for Jill, first Rimso installation was painful to hold and flared you for a week. Said to wait a few weeks for a second. Would you do the second one if it flares? As I've said before, Rimso, also known as DMSO, has fallen out of favor as a therapy for IC because it can be painful. But we also know that in the FDA-approved concentration of 50%, it can lead to irreversible bladder spasms, irreversible muscle contraction. So when DMSO is done, it is normally done in the form of a cocktail with hydrocortisone, a steroid, a numbing agent, maybe like lidocaine, maybe an antibiotic, a few other things like that. So, it is FDA approved for IC. I don't think it would even come close to being FDA approved today based upon the original data that was done in the 60s. Would I do the second one? I think I would talk to him about it. And I would say, now listen, I hurt for a week afterwards. Surely that's not normal. What can we do to make this less painful? Maybe they can put some lidocaine in it, or how about instead doing the most popular bladder installation, which is a heparin lidocaine rescue installation. It's called a rescue for a reason. It rescues you out of a flare. Julianne from New York on YouTube says, how can I prevent a bladder spasm? Bladder spasms happen because the bladder wall is really profoundly irritated. I've had bladder spasms a few times, and they were really because of I had a UTI that I thought was a flare, and I waited 6 weeks as it got worse and worse and worse before I went and finally had a urine culture. So if you're at the point where you're having bladder spasms every day, number one, I would talk to your doctor and I would get your urine tested, and I would even do a next generation urine test just to double check, make sure it's not a fungal infection. And then, make sure you're not doing something like a multivitamin, which is very well known to irritate the bladder wall. If changing your diet doesn't improve it, and you're coming back clear for infection, you're going to be doing ditrophan or Detrol. Oxybutynin is the scientific name for ditrophan. That is really well known to calm bladder spasms very, very quickly within 20 minutes. So you might need to try one of those to try to get things calmed down. But my interpretation of bladder spasms is that it's kind of the equivalent of your bladder screaming. Again, here's your bladder. And if you're, the only way that the bladder can communicate with you is through the symptoms of frequency, urgency, pressure, pain. So whenever you're having those symptoms, that is a message. Your bladder is saying, hey, there's a problem, help me. If you ignore it and you keep drinking that coffee, or you keep doing something you should not be doing, eventually the bladder is going to become so irritated that it's going to start to shake. Just like we do. When you're under stress, like intense stress, what do? You start shaking. At least I do. We call them the Osborne shakes in our family. So I interpret a bladder spasm as the last chance for your bladder to tell you it is in agony and it needs help. And there's got to be a reason why they're happening. Kristen says she's having bladder, urethra, pelvic pain, passing blood clots, walking is painful. Your UTI test strips were negative. How can I heal my bladder? Hun, UTI test strips are not, they are just a frontline test, and they can easily have false positives or false negatives. With the amount of, listen, anytime you're passing blood clots, that is an immediate call to the doctor. That is an immediate call to the doctor. Your bladder should not be bleeding. If you are passing blood clots, there is a serious problem going on. If I were you, I would head on down to urgent care, and I would tell them that you're passing blood clots and get them to test your urine. And or you need to call your doctor and make sure you don't have bleeding Hunner's lesions. But you're not going to fix this on your own. If you're passing blood clots, something else is going on, and you've got to tell your doctor so that you guys can try to figure it out. I'm very big on eyeballs on the organ. I don't like guessing. I think you deserve better than a guess. And there comes a point in time when your pain gets so intense and so severe that you really need somebody to look. And in the case of constant blood clots, that's a given. If it were me, I would want somebody to do a cystoscope, look at my bladder, and see if they see a wound that's bleeding. And if it is, they can then cauterize it. Okay. But again, I think for you, seriously, a completely reasonable thing to do would be a next-gen urine test. Because is there a chance that you could have a chronic deep infection? Absolutely. And chronic infections are not caught by azo test strips. Chronic infections tend to be small but powerful. And so this is the other thing that I would do if I were you, because it also could be a fungal infection, and this will test for candida. So get thee to the doctor, my dear, tomorrow. Unacceptable. You gotta figure this out. And you need to tell them you're bleeding, you're passing blood clots. That is a same day appointment. They should not push you off. Carol says she has an E. coli in her bladder that thrives at pH 5. It drives down my pH. It keeps it there. In the long term, I had constant bladder irritation. I haven't heard of I mean, I know that with menopause, the pH in the vagina changes and becomes more acidic. I don't know if anybody's ever also said that same process happens in the bladder. And so, Carol, again, that next generation urine test would be really interesting to identify the species of that E. coli. And also to see if you've got any antibiotic resistance genes that would account for that sticking in your bladder for such a long period of time. But there comes a point when we all have to admit that we do not know the intact bladder biome. You know, urine is not sterile. The bladder is not a sterile organ. We all thought it was, but this whole advent of this next generation testing has now proven that the bladder has dozens and dozens of species of good beneficial bacteria that live in our bladder normally. And so the question then becomes, is there a small population of E. coli that can live in the bladder copacetically without causing issues? Probably. The question is has it become pathogenic? You know, I think that it's kind of a bacterial warfare. You know, you've got the good bacteria and the bad bacteria, and they're fighting each other. And normally the good bacteria is a little bigger and it keeps the bad bacteria under control. But if something changes, it changes the balance of the good bacteria, like you using an antibiotic, it may be that the bad bacteria is now dominating the good bacteria. And so there you go. Aaron says, can the gag layer repair itself? Yes, absolutely. Hey, listen, the human body is wired to repair itself. That's a miracle of life. That's a miracle. That's a miracle of the human body. And actually, that is also, I want to say, kind of proves the audacity of humankind to think that we know better than the human body, because we don't. The human body is a miracle of DNA and repairing. So let me give you a little kind of anatomy lesson here that I got from a lecture taught by Anthony Schaefer years ago at one of the IC conferences. So again, we have a layer of mucus, and then we have a layer of, we call them umbrella cells. These are the biggest cells in the human body. They are giant. They're giant, massive cells. And if you looked at them under an electron microscope, they look like a beehive. They're hexagons, right? So if one of these cells is damaged and destroyed, then there's a little a tiny, tiny stem cell underneath it. So imagine a pepperoni pizza and then one single green pea. So here you've got this giant pizza and you have this little tiny pea underneath it, right? So when the cell is damaged, you have this little tiny pea that grows and diversifies and changes shape and eventually becomes that pizza. But it takes 2 weeks to happen. It takes 2 weeks to happen. One cell is not replaced overnight. These are monster cells. So what he said in his lecture is, unfortunately, that little tiny stem cell, as it is growing, is incredibly vulnerable and can be easily destroyed. In fact, destroyed perhaps even by a cup of coffee. So here you've got this little tiny fragile cell trying to repair your bladder, and you drink a soda or a coffee and you throw that acid on this baby cell. Contemporary belief is that you've just destroyed it. And that's why the patients who suffer the most by far are the patients who drink one coffee a day or one soda a day. Because what happens then is every time you do that, you destroy your next generation of cells. So literally your bladder, it is impossible for your bladder to repair itself in that environment. And we also see that too with therapies. You know, patients, I hear you're taking Elmeron, you're doing your installations, you're doing all that sort of stuff, right? But at the same time, you're drinking coffee and soda? Yeah, no. There's no treatment that can counteract the damaging effects of one cup of coffee a day. It washes out the cell that's trying to repair your bladder. That's why your job is to create an environment that will support healing. So you got to lose all the fast food and the junk food and the coffee and the soda and go to water and green and chamomile tea and peppermint tea. I almost said green tea. No, don't do green tea. Green tea is agony. And you can't just do it for a week, man. You got to do it for months, because it takes months for this tissue to regenerate itself. Okay. Aaron says, how do you test for yeast infection in the bladder? Hun, it's a special test. I mean, normally yeast in the vagina, they take a vaginal swab, they look at it under a microscope. They don't do that in the bladder. Next generation urine testing can do it all at once. Or they can do another test. I don't know the name of the test, but the thing is, the reason why next generation is so good is you get basically 3 tests in one. Whereas if you're just relying on the typical urine testing, you've got to have a gram-positive bacterial test, you got to have a gram-negative bacterial test, and you have to have a fungal test, which can cost hundreds and hundreds and hundreds and hundreds of dollars, maybe even over $1,000. Whereas a next-gen test, you can get them all 3 tested at once for $199, which is incredible. Because a couple of years ago, it was thousands of dollars to do next-gen. Now it's incredibly affordable. Taryn says, how do you get a doctor on board with the next-gen test? Taryn, over on the Bladder Health website, I have a Q&A with the CEO of Microgen, who takes that question. And, in our summer issue, so guys, this is the summer issue, the IC Network, IC Magazine. This is our newly released fall issue of the IC Optimist. So if you're a member of the IC Network, you can download this now in your member page, or it is being mailed to you as we speak. But in this issue, I have an extensive interview with Rick Martin, the CEO of Microgen. And let me just read his section. Let's see how he answered that question. Here's the question. The results are in, but my doctor doesn't believe them. How should that patient approach their clinic? His answer is, this is a common scenario. If the physician given the report doesn't believe the results, we can show that we have proven concordance. We've done studies that show that if a traditional urine culture grew staph, we are also able to identify and detect that staph 96% of the time using DNA testing. So he says, you can say, well, doc, you treated based on culture, and my culture in the past has either been negative or whatever it was grew. You treated it and I didn't get better. This test, the Microgen test, is saying that my urine has these types of bacteria or fungi. I've never been treated for these. I would like you to now treat me for the dominant species based on DNA evidence versus culture. I have everything to gain and nothing to lose by doing this. I would really like you to be open-minded to making a treatment decision based on this evidence versus doing another culture again. If a urologist sees no value in additional testing, can a patient ask for another doctor? Yes, you can. You can ask your primary care. And even Microgen has doctors on staff that can help you. And here's another question that might answer it. So here's the question to him was, if a patient wants to have the test done, but the doctor minimizes results or worse suggests agar plate testing, how should the patient approach their doctor? Do you have supporting documentation that he or she can share with their clinician? And his answer is, yes, we do. There are a number of papers to show that cultures can only detect 1% of all microorganisms. And there are a number of papers to show that DNA sequencing is more accurate. It doesn't take that much in terms of understanding that cultures have to grow the microbes, DNA, or molecular that's a long sentence. Sorry, I got a little tongue-tied there. We also have head-to-head clinical trials to show that if an antibiotic decision is made on culture versus DNA, that when the antibiotic decision is based on DNA, it's more accurate because patient symptoms come down faster and more of them are cleared up. If a patient already had a culture and already had antibiotics, they should simply say, well, we've done the same thing over and over. We've tried cultures. Why are we doing it the same thing again? Why don't we try a new diagnostic technique? Because I'm still symptomatic and suffering. You can get this if you become a member of the IC Network, regardless of the membership that you get, you will even our $25 membership, you'll get the last 4 issues by email, so you can download this. So and look at that. Come on over to our website, the IC Network, ic-network.com, and click on the shop, and you can go into the member area, or you can order the magazine separately for download. All right, more questions. Kim says, your IC began many years ago after you were treated with Lupron for endometriosis. So Lupron puts you in menopause, puts you in a chemically induced menopause. And so unfortunately, what that means then is you don't have the estrogen to produce the mucus you need to have a nice protective coating in your bladder wall. And so you have probably now been estrogen deprived for many, many years, which means you probably have genitourinary syndrome of menopause. And so for you, if you still have endo and you can't take estrogen, the right therapy, again, is going to be something that would reinforce this barrier. And that is going to be a coating therapy. And most patients start with Cystoprotect or Cystorenew or Desert Harvest Aloe or Elmeron. But again, the challenge with Elmeron is it is incredibly expensive now. Talk about price gouging. It is happening massively. Is that the right term, price gouging? How about profiteering? They've raised the price of Elmeron just dramatically. Elmeron is hard on the body. Only 93% of Elmeron is destroyed by digestion. Only 7% of it actually arrives in the bladder. That's according to the company that invented it. And their name is like right on the tip of my tongue. Dr. Parsons invented it. Baker Norton scientists did the bioavailability studies. And what they found is most of Elmeron is destroyed by digestion. So unfortunately, to get enough Elmeron to be meaningful in your bladder, you have to take a lot of it. And when you take a lot of it, it can provoke a lot of side effects. So Elmeron is pretty tough on the body for some patients. It can cause GI distress. It can cause diarrhea. It can cause blood thinning. It can cause hair loss. And so it's not... it's kind of lost its place in the popular IC treatment modality, especially now that we have subtypes. I mean, now we know, again, getting back to that one treatment fits all approach, Elmeron was approved in 96 before we even understood the muscles were there and before we even understood, the different variants. So now Elmeron makes sense for IC subtype 2 bladder wall driven and maybe a little bit of IC subtype 5 central sensitization to provide a protective coating, or if you are in menopause. But again, the American Urology Association and their IC treatment guidelines put Elmeron in step 2 because it has side effects. They put supplements in step 1 because there are far fewer side effects with the supplements instead. And if you go back on our Facebook page to last spring, to last May, I posted a slide from the class on IC that was taught by Robert Evans at the American Urology Association. And it is the slide that talks about the supplements as mucosal enhancers. So that's just not me. I mean, we've had the supplements now for 15 years and they're very commonly used and commonly recommended by urologists around the country, if not around the world. You cannot buy these supplements at local drugstores. The market is simply too small. You can buy them from us and you can buy them from the manufacturers. There are not a lot of resellers for them for a number of reasons, but we always have them. We've been selling them for years. So you can find them right on the IC network. And I just want to say one thing here real quick. It was never my intention to sell stuff through the IC network. I mean, guys, this was my doctoral dissertation to provide support online. I mean, it was my doctoral dissertation proposal. I paid for it for 5 years, didn't take any money. And then finally it got so big, we needed to have some income to pay for servers and stuff like that. So we started selling books and chair cushions and heating pads and stuff like that. I mean, that made sense. But I got really angry. It was after Interstim was approved. There were doctors who, if you're not familiar with Interstim, it is neuromodulation. It requires surgery to do. And it's a nice little profit-making thing for doctors. And so what was happening is we had doctors, especially in Colorado, who were setting up Interstim shops. And they would get a patient referred to them. They were urologists. They'd get an IC patient referred to them. And they wouldn't tell them that there were other treatments. They would just say, hey, man, we can fix this with this surgery. And if you're familiar at all with Interstim, you know that we have a lot of complications with it, hundreds and hundreds of very serious adverse events filed with the FDA, including fatalities. And so some of these patients got back to me and they said, you know, my doctor said there was nothing else. They didn't even tell me about diet. And I'm like, what the, you know what I was going to say? WTF? Are you kidding me? They didn't even tell you about food. They didn't tell you about Elmeron, oral medications, nothing. They said, no, they said it was Interstem. And that's when it just kind of dawned on me that patients need to know their options. And this was probably, I'm going to say, around 2000, the year 2000, 2001, somewhere in there. And so I decided, you know what? I don't want patients to have a surgery that can damage them permanently. Let's at least give them what their potential options are with the supplements, because, man, these were invented by IC researchers, right? I mean, the guy who invented Cystitis, big federally funded IC researcher, Dr. Theoharides. And so, you know, I kind of went out on a limb and started selling supplements. I felt it was my duty to. And then the AUA guidelines came out in 2011, and guess what? They recommended supplements in step 1. So my approach turned out to be accepted by the largest urology association in the world. So supplements are viable, especially in this day of expensive therapies. If you can't afford $2,000 a prescription for Elmeron, as I certainly couldn't, at least you can try a supplement which is under $50 a month, right? So there you go. So you can find them on our website. Karen says her IC began after a car accident where her pelvis was fractured in floor places. Stick shift went into the kidney. Yeah. So you sustained a muscle and or potential bladder injury from that. Ravonda asks, had bacteria and microgen results, should you hold off on Cystitis, which covers the bladder lining so the antibiotic can reach everywhere? Well, hon, the antibiotic is delivered through your bloodstream. Unless they are doing it in a coating, I mean, like in an installation, then your question makes sense. But most antibiotics are delivered via the bloodstream. And so I don't think that would make that much of a difference. I'm going back to YouTube questions. God, I love you guys. You know what? This is so cool because you're supporting each other. This is wonderful. So I'm going back on YouTube here. Extract says, what do I think about aloe vera and probiotics? Hey man, step 1. The risks are low compared to other therapies, so why not give it a shot? The challenge with aloe is that some people are aloe intolerant, and it gives you gut distress. There's kind of something interesting happening with probiotics. Some patients are flaring after taking probiotics, but honestly, I think it's a brand issue. I think it's a manufacturing issue. And so if you flare with one type of probiotics, change your brand. The brand we sell in our store, Douglas Labs probiotic. And the one that I use, let me go get it. This is the one that I have used for years, but let me take off this plastic cover. Hold on a second. Solgar Advanced Acidophilus. You know, there are many schools of thought with respect to the use of probiotics. Number one, if you take the same probiotic over and over and over again, you know, you're kind of disrespecting the fact that you have an incredibly diverse bacterial population, and we're still trying to identify what a normal urinary biome is. So if you keep taking the same probiotic over and over and over and over again, you're potentially creating an overabundance of that one species. So theory number one is you got to mix it up. And so I tend to go from advanced acidophilus to something like the Douglas Labs one. But I don't take probiotics every day because I eat really well, and I really only start slamming probiotics. And when I say slam, like one or two pills, when I start feeling a little IBS, that's when I kind of know that I've done something that's kind of disrupted my biome to a certain degree. So anyway, if you flare with a probiotic, I think that number one, there can be something in the manufacturing of it that is being irritating, or maybe it's the wrong probiotic. Maybe you've created a bacterial imbalance. You know, Diane Manhattan was one of my dearest friends, and she helped me start the IC Network. She managed our forum for a decade. And she was the first patient that ever got an infection from overusing probiotics. And they had a hard time fixing it. Diane sadly passed away. She was actually murdered by that. If you guys remember, there was a respiratory therapist in New Jersey who was killing people, killing his patients. And she was one of his last murder victims. And so the IC Network is dedicated in many ways to her memory. Diane and I were opposites. Here I came in with 3 college degrees, super academic, and she didn't go to college. She was a waitress. She had the most amazing heart of gold. And she was the sweetest, kindest person. She would send patients money. She getting up at 4 a.m. She'd answer our forum, and then she'd go to work at 6 a.m. And then she would share her tips with other. I had no idea she was doing that. When she actually told me she was doing that, I told her to stop. It's like, you can't do that. You need to protect yourself too. But so whenever you hear IC Angel, we created the IC Angel program after she was murdered about 10 years ago. And that's a volunteer program where we help patients who are in need. I know that the ICA started using IC Angel for their subscription, and that kind of pissed me off because this was about honoring somebody who was murdered. Anyway, I won't rant on that. Let's go back to your questions. Anyway, say a prayer for Diane. She's here on my shoulder every day. I love her dearly. Always will. So grateful. So grateful for her. Patricia, I have been having spasms in my lower right side in the ears. Okay, hold on a second. I have been having a spasm in my lower right side, like the lower intestine. It would twist in a knot. Is that my bladder? No. Your bladder is right above your pubes, hon. It's just like literally centered above your pubes, below your belly button, but it's low. It's like literally down behind your pubic hair. It sounds like pelvic floor and or something going on with an ovary or something like that. Karen says, can you get a next generation urine test without a doctor's order? And when you get the results, will your doctor order the sensitive antibiotic if you didn't order the test? Yes, you can get it in 25 states. You can order it on your own. But what they will not do is give you the comprehensive antibiotic tests. What they want you to do is bring their results to your doctor, and then your doctor will sign off on them. And then your doctor will receive the really, really aggressive tests. And I wonder where mine is. You know, on the page on our website dedicated to it, I actually have copies of my results so that you can see what they look like. We're simulcasting on Facebook and YouTube. And for anybody new, my name is Jill Osborne. I'm the president of the IC Network. I'm the National IC Support Group Leader. Been a support group leader for 25 years. And we just started, we did live support groups on the internet for years over on the IC network, but it was in a chat room. It was text-based. But with Facebook Live and YouTube Live now, we can do an actual real video meeting. And so that's what this is. We're back to doing live support group meetings. By the way, we're also going to be the first group to actually start streaming. I think I'm going to start streaming an hour or two a day, walk in, where you can come in and ask your questions through Twitch TV. How's that for crazy? I don't know if you would like that or not. Having a Twitch channel, the ICN show, the ICN something. I have to come up with a fun name for it. Chica on YouTube says, how do you manage pelvic pain and urinary frequency associated to anxiety and fear? I've been dealing this with 3 years. Pelvic floor does not work since my anxiety always pops up. So, hon, you actually just kind of answered your question, because I mean, you got to understand a couple of things. Is you've got what we call the fight or flight response. When you're frightened and stressed, your body perceives it to be a saber-toothed tiger attacking you. And there is a chemical reaction to that. So what happens is what we call the fight or flight response. So with a fight or flight response, your body, when you're stressed, prepares you to fight or run. So blood gets diverted from your pelvis to your limbs, to your legs and to your hands, so that you can fight or you can run. There's this whole biochemical cascade that happens. And that's triggered by adrenaline. When you get startled, you go, right? You get, okay, well, biochemically, that is a big shot of adrenaline into your bloodstream. And then it's that adrenaline that gets you ready to, to do whatever you need to do. So one of the things that we've learned is, for those of us with anxiety, and I'm one of them, because as part of central sensitization, is that we struggle to process adrenaline. And I would bet you, Chica, that you are really easily startled. It's super easy. I get startled if I'm driving. If I see anything flicker around the side of my eyes, like on this side of the car, I will jump sometimes. I get startled. So the key is learning how to control adrenaline. If you can modulate adrenaline levels in your bloodstream, your anxiety levels are going to drop dramatically. And I learned this in a class that I took on anxiety management that was developed by a surgeon with anxiety. Can you imagine being a surgeon with anxiety? But it was hereditary in his family, and his son had anxiety. And he developed it for his son. And so basically, he looks at anxiety very, very different way. When I was growing up and struggling with anxiety, and I had good reasons to struggle with anxiety because we had some issues with a very violent person in my neighborhood. I always thought that anxiety management involved going to a therapist, having counseling, going back in your childhood, trying to figure out what happened and why you're so afraid of life. And I always was incredibly reluctant to do that. And what he said, number one, because I'm very, very well adjusted. I never really felt that going into even greater therapy than I'd already done would help my anxiety. And now we know why, because of central sensitization. Okay, so this is what he said. The key to anxiety management is to control adrenaline. So how do you control adrenaline? It's a 3-step process, super easy to do. So every time you have a negative thought, I need you to fill your brain up with a stop sign. Just close your eyes and just go stop. Just for 2 seconds, 3 seconds, visualize a stop sign, right? Then take a single deep breath in, out. Then the third step is to minimize the thought. Just say, so what I say to myself is, oh my God, Jill, you're not God. You can't predict the future. That's only a thought. It has no power. Get a grip, right? And if you're a typical anxiety person, you have a lot of negative thoughts. I mean, if you watch my videos, you know I'm a really happy, optimistic person. And yet inside my brain turns to the negative first, and it's incredibly annoying. And I've asked people why that happens, and what they give me a biochemical explanation that negative thoughts are kind of easier to process or something. I don't know. I don't understand why. But the odds are, Chica, if you pay attention to the way you're thinking, you're having negative thought after negative thought after negative thought all day long. You probably had 200 negative thoughts today. That's 200 shots of adrenaline. So you got massive levels of adrenaline floating through your bloodstream that's driving all this anxiety and making the negative thoughts worse. So what they had us do with this 3-step system, stop sign, deep breath, minimize the thought, is they sent us home and they said, every single time you have a negative thought, do it. Just do it. And they were right. For like the first day, I did it like 200 times. It's like, oh my God, I had no idea I was dominated by negative thoughts. The next day, I did it like 100 times. The day after that, I did it like 50 times. The day after that, I did it like 25 times. A week later, I was doing it once a day. And my anxiety was almost gone. Why? Because I'd taken control of all the adrenaline. I'd gotten all the extraneous adrenaline floating out of my bloodstream. And now when I haven't had a panic attack since I took the class, including going through a major cancer scare. On the way to the hospital, you'd think you'd be having a panic attack to have surgery. I didn't, because I'm doing my stop sign, deep breath, minimize the thought. Okay. So I want you to try that. And let's see if we can get that anxiety under control so that you're not having your flares from the anxiety. You know what? I need to get a Kleenex. Hold on a sec. All righty then. Oh, Chica, I promise you that when you try that, it's gonna give you so much more control over your life and away from the anxiety. I think it'll be really helpful. All right, let's go back to Facebook. Miss Manda said she just had ESB, and they had a PICC line for high dose antibiotics for a week. You still have a UTI. Your feet keep swelling. That's probably from the antibiotics. Hon, they just have to follow up with the testing. Listen, once you're at the point that you've got a PICC line and high dose antibiotics, all you can do is really focus on your probiotics, eat really healthy, and let that testing continue and see if they've made a dent in it. You could do next-gen testing before you start the antibiotics and after you start the antibiotics to see, or after you finish the antibiotics, to see how that has changed your bacterial load in your bladder, both good and bad. Hi, Nancy. Alexis asked, do yeast infections and BV occur more frequently when you have IC? No, but they occur more frequently if you are having hormone issues or if you have genitourinary syndrome of menopause, definitely. Maureen said she had an Interstim implant for the second time, causes a lot of lower back pain and leg aches. You need to tell them that you're having back pain and leg aches because they need to adjust that. Interstim should not be causing any peripheral pain like that. If it is, that tells me that nerves potentially are being overstimulated and damaged. So you need to be very vocal with your doctor and let them know that that is happening. We had a patient who had Interstim who every time she had a bowel movement, she got shocked. And her doctor told her that was normal. And I told her, oh, hell no, that's not normal. And I got her on the phone with the doctors at Medtronic, and they went, oh, hell no, that's normal. And they had to revise it. The doctor who did the InterStim was clueless. That door needs WD-40. Good point. It probably does. Hey guys, so we released our magazine, The IC Optimist, and I have copies to give away. So I have 25 copies to give away. So if you would like a copy of our next of this magazine, which features an in-depth interview on the Elmeron and IC, as well as an in-depth interview with Dr. Angie Storr, a pelvic pain expert who wrote the book When It Hurts Down There. Also, we have The Secrets of a Successful Disability Application, a new article on Money Lucas, Singular, Controlling the Symptoms of IC. I only have 25 copies. If you would like one of these and you're not already subscribing, as you're going to get it away, you can send me an email, icnetwork@mac.com, and I will send it to you by email and or in print. Actually, it'd be easier to send it by email. I'd be happy to send it by email. So if you email me, icnetwork@mac.com, I will pop it to you by email. But again, I'm only going to do 25 copies. I can't do more than that. But if you would rather have it snail mailed to you, I will do that. If you're in Europe or Canada, I will only email it to you. I will not snail mail it to you because it is too expensive. So you send me your information, the first 20 or 25, I'll go ahead and do that for you. All right. All right. Now I have a question for you guys. I would love to know what your favorite IC friendly holiday treat is. What is your favorite IC holiday treat? At some point in time, we all deserve a treat. And I'm trying to keep sugar down and trying not to eat cookies. I eat sugar cookies without frosting. And actually, the far more important question, you know what? Let me change it up a little bit. So I want to release, after the new year, I want to release a brand new cold and flu guide for IC, the things that patients can do who are struggling with colds and flus and not irritate your bladder. And if you have something that you can use, like as an example, cherry Ricola drops or a Vicks throat lozenges, cherry seem to be the popular favorites. For non-bladder irritating throat lozenges, a honey candy, honey, something that you can suck on, a honey sucker or a honey pill, that seems to be very good. Sambuco has been a favorite of IC patients for many, many years. There are some kind of Vicks Vapor Rub is a given. Vicks Vapor Rub's not going to irritate it. Smother it under your nose, on your throat, anything like that. There are also some kind of Vicks Vapor Rub shower bombs, bath bomb. You put it in the shower in the hot water and it dissolves and you get this nice eucalyptus. Those are pretty good, but there's a lot of those on the market now that have a lot of toxic chemicals in it. So make sure it's not made in China. Look at the ingredients, maybe only use half of it or quarter of it, and be prepared to run out of your bathroom if you're like me and have central sensitization and strong smells bother you. But I would really love to know what you do when you have a cold or a flu. What do you turn to that does not irritate you? Karen, yes, absolutely. It's absolutely possible to have more than one subtype. I am IC subtype 5, central sensitization, IC subtype 3, pelvic floor primary, and my bladder is secondary. My bladder, for the most part, is pretty calm, unless I do something really foolish. And I'm going to do something really foolish on New Year's Day because this is my year without coffee. I have had no coffee this year. And even though I think about it every day, I want my latte of course, a low acid decaf latte. My resolution for 2018 was absolutely no Starbucks, no coffee. And I could only do it if I did something really hard, which I did twice. I did 2 long trips for me. So I have had 2 lattes this year just for that. But on New Year's Day, I'm going to Starbucks and I'm getting a latte. I have to come up with my resolution for next year. Lisa says, Gulart white chocolate mint snow caps available on Amazon. Ooh, I need to look that up. Stracked asks, how is my sex life? Because every time I have sex, I flare. Does it happen to all AC patients? I am not in a relationship right now. So there are things I could say. Am I capable of having an orgasm? Absolutely. I know that for a fact. Does it hurt my bladder? Absolutely not. Absolutely not. But that is because there's no penetration. It is a, I don't need to, you know what I'm talking about here. Generally, when you flare after sex, we don't normally flare during sex. We flare the day afterwards. And that's really interesting. A man with IC is going to flare when his muscle spasm is the strongest, which is the moment that he ejaculates. So a man with pelvic pain or chronic prostatitis, something like that, for them, their worst, quote unquote, pelvic pain happens as they ejaculate. For a woman, it's about 6 to 8 hours after we're done having sex, because that's when our pelvic floor muscles do a very nice, gentle spasm. And we have very subtle spasms for a good, I think, 12 to 24 to 36 hours, which I think biologically is about helping sperm meet egg. And so it's very normal for a woman to flare the day after or hours after they have sex. And again, that's a pelvic floor flare. That's when you whip out a vaginal Valium suppository, you take a hot shower, a warm bath, a muscle relaxant, baclofen, Flexeril, vaginal Valium suppository will get you out of that pelvic floor flare. And so that's normally what a woman will do with that. And it's very, very doable. And of course, if you're having flares with sex, that tells me that your pelvic floor is funked up somehow. I said funked up. Did not say the other word. It's funky in some way. And so I think it was very, very important that you have a pelvic floor assessment. Let's see if we can figure out what's going on with your pelvic floor. If your pelvic floor is tight and dysfunctional, let's fix it. And physical therapy would really do that. Along with, I also have, where is it? Where is it? It's a book. Oh, here it is. Okay, so this book is cool. Secret Suffering, How Women's Sexual and Pelvic Pain Affects Their Relationships. And this is kind of like the Bible for a woman who's struggling with pain. It explains why. And then she has 64 tips to relieve sexual and pelvic pain. Look at that. I opened up right to that page. Wow, that's crazy. Yeah, really good. I mean, so number one, and this will also talk about sexual positions, finding the right position that won't put extra pressure on your pelvic floor. Typical missionary tends to be a little bit pelvic floor traumatic. It's better if the woman is on top and the man is on the bottom. You know what I mean? You're riding your cowboy. God, I'm bad. I would also encourage you to get this one, Ending Female Pelvic Pain, because this is the one that will teach you the most about how your pelvic floor works, and has lots and lots of suggestions on stretches and rolls and all sorts of things that you can do to work on whatever muscle happens to be your issue. This is something that I do a lot, by the way. I have a foam roller. You can see that she's on a foam roller sitting. I do this frequently because this really helps the piriformis muscle. And this one, that's also really, really good. And then my new favorite book by far is When It Hurts Down There by Dr. Angie Storr, who's an OBGYN in Texas. And this is the book that teaches you how to interrupt pain messages from the spinal cord, the low brain, the midbrain, the upper brain. And it's so beautifully written. It's so simple. It's so easy. One of the things, so what she says is when you think about a pain message, it starts in your bladder, goes up your spinal cord, goes to your lower brain. And it's your lower brain that has a gating effect. It tells your brain what's important. So it will not let all pain messages through. It will only let the most important pain message through. So that's one place you can interfere. Then it goes from the low brain to the midbrain. And the midbrain is what establishes emotional context. The midbrain is what helps you determine, is this good pain or bad pain? If that pain is accompanied by fear, it is bad pain, and the pain gets intensified so that your body, your upper brain acts quickly. But if that pain is accompanied by happiness, that pain message is minimized. It's greatly minimized. So that's another place where you can interfere with pain messages. Man, that whole power of positive thinking, now we know why positivity is so helpful, because the midbrain really does minimize pain messages if it's accompanied by good, happy thoughts. And I'm living proof of that. I'm absolutely living proof of that, because it was the book, The Power of Positive Thinking, that really changed my life. Somebody gave it to me in 1995. Love that book. So it goes through here, and then it finally reaches the upper brain. And it's the upper brain that does the work. It's the upper brain that tells you to pull your hand back. It's the upper brain that processes the biological and physical reactions to pain. And it's not like a straight line. It's not like there's one nerve and it goes wink like that. It's like a thunderstorm. So when it reaches the upper brain, it's like this part lights up, and then this part lights up, and then this part is a beautiful thunderstorm. If you've ever flown over a thunderstorm in an airliner, it's amazingly beautiful. And so the secret to controlling pain in the upper brain is to occupy those sources of the brain so that they cannot be used. And she does a fabulous job talking about that. And then last but not least, I think the one thing in here that really resonated with me is something called learned fear. Learned fear. So I have a very clear fear of traveling. And it happened in my 20s when I had IBS, and was reinforced in my 30s when I got bladder pain. I was afraid to travel because I never knew when I would have a bathroom, and I never knew if I would have an issue. And my life got smaller and smaller and smaller with this. But I was really, really sick. So it really made sense to have that fear of traveling. But I'm not that sick anymore. But I still have a learned fear of traveling. And much to my regret, I've missed a lot of opportunities because I tend not to go far from home. Even my brother lives, 2 hours away in Sacramento. And, I've only been to his new house once. And it took a lot of work for me to get there. I mean, I had to practice. And she talks about that. So I got in my car and I drove, instead of driving, I drove 10 miles the first day to prove I could do it. And I drove 20 miles the second day, and then 30 miles the fourth day. And then finally, I was just so sick of it. I just got on the freeway and went. I was like, I'm getting there. And I stayed there all of an hour, and then I came right back home. But she talks about learned fear and how important it is that we acknowledge it and try to work on that. And that has really helped me it's helped me see that that my thinking is normal, but you don't have to stay that way, that there are things that you can do to get yourself over that. And it's really just starting small and proving to yourself that you can actually do it anyway, whether it's sex. And I kind of apply that to sex too. In my local support group, we talked about sex a lot. And there's one very memorable day when I had a couple basically start fighting. And the IC patient was mad at her husband because he wouldn't give her a hug. And his reaction back was, because every time I give you a hug, you tell me not to touch you. And I don't want to hurt you. I love you. I don't want to hurt you. And then she started crying, and then he started crying. And we had this wonderful moment as a group where we all bonded together around this couple. And ultimately what it came down to was trust and communication, that when you're in pain, you cannot expect your partner to read your mind and know that you're in pain. If you need a hug, you need to ask for a hug, and you need to tell them that it's okay. And that same kind of applies to sex too. If you're in pain and sex comes up, you need to really say, listen, honey, I love you so much. That has not changed, but my vagina does, and my bladder does not want anything down there right now. But that does not mean that I cannot love on you some. And when you're feeling frisky and you're feeling like you can do it, be clear about it. Say, honey, I'd really like to try, but let's go slow and let's just see how we do. And we want you to be intimate. We have a really good area on our website that gives some tips on sex and intimacy. Many IC patients have completely normal lives and have babies and all sorts of things. Do not assume that just because you have IC, your sex is going to hurt. The dominant reason why sex hurt is because you have tight muscles. And the one thing we know about muscles is they respond beautifully to physical therapy, and we can get you enjoying intimacy again. All right. Okay. Last call for questions. We've been doing this for almost 2 hours, and I haven't eaten anything today. I need to go eat something. Cindy said, how do you travel with pelvic issues? Do you have to cath and you're afraid to travel? And that's just kind of what I talked about. Number one, you got to have your routine. It's hard when you have to cath. You start small and build confidence and trust, and just kind of know that you have to pick your time on when you travel. If you're feeling miserable, that is not the time to get in the car. Start with small trips first. Practice, and I think Starbucks has a great bathroom that's open to everyone. So stopping at Starbucks would be a really good, fairly clean place if you need to catheterize. Some people get their car adapted. Some people have pop-up tents, so you can pee on the side of the road inside a pop-up tent. You can open your front door, and if you have a sedan or an SUV, open the front door, back door, and you're covered on 3 sides. Have a family member stand there, hold a coat up there. You can pee on the side of the road. But with a cath, it's definitely more challenging. I mean, I'm a homebody. I like to stay home. I've never been, because of my health issues, traveling is not something that I have really ever enjoyed. Whenever I'm traveling, I'm thinking about is the trip home and getting home. I just much prefer to be home. I'm a homebody. Omega says when she has a cold, use frankincense and lavender essential oil in a diffuser. That's a great suggestion, as long as you don't have cats. Essential oils can kill pets. You got to be really careful with that. So Google that. But I've heard that about lavender before. Kim says, Ending Female Pelvic Pain is an excellent book. And for the guys watching this, we have a book. She also has a book, Ending Male Pelvic Pain. So there's 2 books, Ending Female Pelvic Pain, Ending Male Pelvic Pain. These are all available in our store on the IC Network. Hello, Cindy from Canada. Nice to see you. All of these books are available on the IC Network. Absolutely. All right, my friends, listen, if you find these meetings helpful, I need you to do something for me. I need you to support us because they do not happen for free. We have significant bills that we have to pay. And the way that we operate and we pay our staff is through memberships. And so we release a member magazine quarterly. It's called the IC Optimist. It offers in-depth stories. Many of these stories will not appear on our website for at least 6 months. We want to give you really useful things that you can use immediately. This is not a brag piece. We don't really talk about things that we're going to brag about the IC Network. I want you to read this and within 5 minutes find something useful that will help you. Okay. And so if you would like to become a member of the IC Network, come on to our website, ic-network.com, and you can click on our shop and go in there. And of course, you can also support us by buying stuff, all these books and supplements and stuff from us. All righty then. And just so you know, we are in the process of moving our website. We have moved our forum over to a new server. We have moved our store somewhere else. I'm doing a divide and conquer strategy because the internet is such a scary place these days. So if you're over in our support forum, it looks very new, very different, a little sterile. It was because I did 2 all-nighters this week with a company in England working on that, and they lost all of my customizations, and I haven't had time to do them. Extract, do we send books to Europe? Yes, we do. Absolutely. So if you go to the forum, you're going to notice it looks a little bit different. Just know, in fact, we can't even bring new users on automatically right now. Part of that's broken. It's just the normal wear and tear of doing new software. They're working on it. Okay. I always end meetings with a very important message. The single most important thing I want you to hear from me right now is that this is not your fault. You have done absolutely nothing wrong. I don't want you carrying any shame. I don't want you carrying any blame because you're struggling with IC, especially during the holidays. Especially during the holidays, hon. You're no different than someone who is hit by a car. You need love and support. You know that if someone broke their leg in your house, you not only would you take them to the hospital, you would bring them back, you would bring them homemade food, you would change the TV channel, you would do whatever you could to love on them while they were healing. You deserve that same love. And so I hope during the holidays you will be honest about what you're going through and ask for help when you need it. Bring the holidays to you. Do potlucks. You don't have to do everything. And I also don't want you to hide it. If you need help explaining it, I've got some videos on our website in our Living with IC videos on how to deal with family members who might not be informative or instructive. Again, if you have our magazine, you can hand them the magazine. This will go a long way in explaining to them that what you have is real and why it can be a challenge treating it because of the subtypes. Especially during the holidays, I want you to do 3 things. The first thing I need you to do is 15 minutes a day. I want you to do something for your soul. I don't care what it is. It's just something that nourishes you, whether it is taking a walk, whether it is walking through a forest and hugging a redwood, whether it's going to church, reading your Bible, whatever. Do something that will nourish your soul. Your soul, it does not change because you have IC. I want you to keep it below the waist. It's not above the waist. So number 1, 15 minutes for your soul. Number 2, I need to do 15 minutes for your bladder. Do something that will calm and soothe your bladder. Okay, whether it's drinking a cup of chamomile tea, which you absolutely hate, or saying no to that coffee, or doing your physical therapy stretches, which I've got to do after this. Do something for your body. And last but not least, do something for your noggin. Do something for your brain. Learn about IC. Do not come on to social networking and expect to learn about IC. You know, it's amazing. I was looking at our website stats, and you can see that they go, even though we're having our best year ever with respect to helping patients, our website stats are going lower and lower because I think websites are the dinosaurs now of the internet. I think it's all about these videos. That's how people are finding us, and social networking and stuff like that. But please come back to our website and read the content there because it's really good. I need you to be so strong, so knowledgeable, so informed that when you go to the doctor, you can kick butt. You take charge of your healthcare. If anybody has the audacity to tell you that IC is all in your head, you're going to have every argument you need to prove them wrong. That is the point of the IC Network, and that is the point of these meetings and the point of our website. So please come on back to the IC Network and check out all the new stuff that we've done. All right, got lots of new blogs, all sorts of stuff like that. So read 1 article a day. Alrighty. All right, good people, it's time for food. I wish you well. As always, you can call us 1-800-928-7496 if you have questions. And we're always, always happy to help. All right. Happy holidays, everybody. Hope you have a wonderful evening. Put some Christmas music on. Play Fortnite. Do something fun. I'm going to play Fortnite. Okay, I'll talk to you later. Goodbye, Facebook. And goodbye, YouTube. See you later.